And hello, this is Jim Miller, and I'm doing a live show here. It's a daily live show that where we talk about fun and entertaining news and views, opinions, all about generational wealth and longevity health. And what I've been liking to do is just find some articles right now and bring them up and talk about them. So if you happen to see this, I'm on Facebook and LinkedIn and I think YouTube. If you happen to see this and you want to chime in, love to have you on. I'm going to pop up the comments here. So hopefully I'll see them. And if I do, I'll recognize you. Appreciate you chiming in, saying hello, giving us a shout out. So yeah, this is just a daily fun live show that I'm doing to talk about various things with health and wealth, and just see what we can come up with here. Start some conversations. I love that. So with that, I found one that I thought was interesting. It's in the healthcare sector, and it's all about President Joe Biden, who has figured out a way to solve part of the medical health issues in fulfilling a promise that he'd made, apparently, at the beginning of his term. And so I'm going to bring that up, and let's see if we can kind of break it down and see what it's all about. And so it says Biden administration bars medical debt from credit scores. Wow. So that means that if I have credit debt, the credit card companies, Experian and whatnot, can't come back and tag me for that and lower my credit score. Which, yeah, on the surface, that it seems like a pretty good idea. But really, is it? Is it the great idea? Or is it just another way to kick the can down the road? I'm thinking it's probably just another way to kick the can down the road. But let's explore that. If you have an opinion, chime in. Love to hear what you have to say. So this is from KFF Health News. I'm not really sure who that company is, but this article was published yesterday, January 7th, 2025. So it's new. So it's Noam N. Levy, Levey is the author right up here. So yeah, if you want to look that up, it's kffhealthnews.org is their website. So check it out. And if you want to republish the story, you can just go here and republish it if you want to. So here's what they say. Consumer Financial Protection Bureau. The Federal Consumer Financial Protection Bureau on Tuesday issued new regulations borrowing medical debts from American credit reports, enacting a major new consumer protection just days before President Joe Biden is set to leave office. The rules ban credit agencies from including medical debts on consumers' credit reports and prohibits lenders from considering medical information in assessing borrowers, which, on the surface is an important thing right now to do because there's so many. It's like you'll see here in a minute, over 100 million people are saddled with medical debt, and most will not pay it back in their lifetime. So they're stuck with this debt. And if, when you have that in your portfolio, if you will, and you can't pay it back, it starts dinging your credit rating. It makes it really hard to do anything in life now. You can't buy a car, you can't buy a house, or if you do buy something on credit, it's either you don't get the credit or you have to pay a lot more for the credit. So it becomes very difficult to do life if you have a medical bill hanging over your head. So what the Biden administration has opted to do, instead of really digging in and fixing the problem, is just figuring out a way around it and making give somebody else the pain. The debt doesn't go away. It just doesn't get shown on the credit bureau. So it's, in my view, really irresponsible, a way to solve the problem. It's not a solution at all. But this is what we're dealing with, and I'd like to explore that today. And if again you are watching this and you happen to have a comment, I'd love to hear what you have to say. So it says these rules, which the federal watchdog agency proposed in June, could be reversed after President-elect Donald Trump takes office on January 20th. But by finalizing the regulations now, the CFPB effectively dared the incoming Trump administration and its Republican allies in Congress to undo rules that are broadly popular and could help millions of people who are burdened with medical debt. Well, yeah, but it's really not, in my view, a solution. People who get sick shouldn't have their financial future upended. The director, Rohit Chopra, said in announcing the new rules. The final rule will close a special carve-out that has allowed debt collectors to abuse the credit reporting system to coerce people into paying medical bills they may not even owe. Maybe so. Let's explore that. So the regulations fulfill a pledge by the Biden administration to address the scourge of health and healthcare debt, a problem that touches an estimated 100 million Americans, forcing many to make sacrifices such as limiting food, clothing, and other essentials. Credit reporting, a threat that has been wielded by medical providers and debt collectors to get patients to pay their bills, is the most common collection tactic used by hospitals. And that was from a health news analysis. They found that the impact can be devastating, especially for those with large healthcare debts. There's growing evidence, for example, that credit scores depressed by medical debt can threaten people's access to housing and drive homelessness. People with low credit scores can also have trouble getting a loan or can be forced to borrow at higher interest rates. Yep. That has prompted states including Colorado, New York, and California to enact legislation prohibiting medical debt from being included on residents' credit reports or factored into their credit scores. Still, many patients and consumer advocates have pushed for a national ban. There's estimates that the new credit reporting rule will boost the credit scores of people with medical debt on their credit reports by an average of 20 points. So if you're at 680, it could put you over 700, which is really good. It's like you want to be at 700 or more. And if you're at 720 or above, you get the best rates. So you want to be a minimum of 700. So going from 680 to 700 would be a benefit for sure. The agency's efforts to restrict medical debt collections have drawn fierce pushback from the collections industry, of course, and the new rules will almost certainly be challenged in court. So let's see. So people are trying to fix this problem, and let's take a look at this estimated 100 million Americans. What is that all about? Diagnosis debt. So here's a statement. More than 100 million people in America, are a startling 41% of adults, are saddled with medical bills they cannot pay, according to the KFF Health News investigation with NPR and CBS News. The project exposed that medical debt, rather than fighting disease, is now a defining feature of the nation's healthcare system. Wow. So here's some sub-stories. 100 million people in America saddled with debt. June 16, 2022, the U.S. health system now produces debt on a mass scale. A new investigation shows patients face gut-wrenching sacrifices. In America, cancer patients endure debt on top of disease. Medical breakthroughs mean cancer is less likely to kill, but survival can come at an extraordinary cost as patients drain savings, declare bankruptcy, and lose their homes. A KHN NPR investigation finds. Yep. And then nursing homes are suing the friends and family of residents to collect debts. That's a whole new way to put friends and family to work for you. Debt lawsuits, long a byproduct of America's medical debt crisis, can ensure not only patients but also those who help sick and older people be admitted into nursing homes. Wow. So few places have more medical debt than Dallas-Fort Worth, but hospitals there are thriving. Some hospitals notch big profits while patients are pushed into debt by skyrocketing medical prices and high deductibles. And let's see, Knoxville's Black community endured deeply rooted racism. Now there's medical debt. Despite the end of Jim Crow segregation, the legacy lives on in medical debt that disproportionately burdens Black communities. And then how banks and private equity cash in when patients can't pay their medical bills. Hospitals strike deals with financing companies, generating profits for lenders and more debt for patients. So it looks like Germany's coal miners can teach America about medical debt. Coal mining ended in Germany's Saarland a decade ago, but the tradition away from coal has been smoother than in West Virginia, which has more medical debt than any other state in America. Might be worth reading. And then hundreds of hospitals sue patients or threaten their credit. Investigation finds. Does yours? An examination of billing policies and practices at more than 500 hospitals across the country show widespread reliance on aggressive collection tactics. And then a father dreamed of a home for his family, and medical debt nearly pushed him onto the streets. That was September 2023. As cities like Denver struggle to make homes more affordable, medical debt keeps housing out of reach for millions of Americans. So let's see some numbers here. Wow. Who has healthcare debt? Here's the share of adults who have had healthcare debt in the past 5 years. Again, this was published yesterday. So this is topical, brand new data. So age, who has healthcare debt by age? So 18 to 29, 55%. That's the Gen Zs that we were talking about the other day. And then 30 to 49 years old, 69% have healthcare debt. And then 50 to 64 have 60%, and 65 plus have 37%. So wow, that's a lot of people, 100 million. So, and then race and ethnicity, pretty high everywhere. White, Black, Hispanic, everybody's got some debt. So there's really no special, nothing special about that. It's just everybody's got it. So debt hits even high income and insured people. Share of adults who have had healthcare debt in the past 5 years. Annual household income, less than 40K, 68%. 40 to 90K, 57%. And over 90K, 45%. Still high. You'd think somebody who's making 90K or above wouldn't have to worry about the medical. But yeah, they do. Yeah, they do. They've got just as much problem as anybody else, especially if they're not managing themselves well. So it's definitely an issue and definitely worth looking at. And if you're involved in a situation like this, need to fix it, and you can. And as I've been talking about, it's passive income and residual income streams. You get that Plan B income coming in and pay those debts off, and have another income coming in. So, and there's also alternative healthcare programs. If you're employed and you have a free quote unquote healthcare system or program that you're in, then yeah, maybe that's good. But it's definitely, especially if you're an independent business owner, an agent, a broker, insurance, real estate, or a mortgage, looking at an alternative to healthcare like Impact Health Sharing is an amazing opportunity for you to see, save up to, between 30 and 70% on your healthcare and get a better coverage. So hit me up if you have any questions on that. So, insurance status, respondents under age 65. Let's see, insured 61%, uninsured 71%. 71% are going uninsured right now. That's keeping your, oh man, that's just being out in the breeze. And that's why so many people are going bankrupt, because they get these bills. And you go into the hospital, like I mentioned the other day, if you get into an accident and you just need a helicopter ride, you're going to get, $50K for the helicopter ride. And that's just getting to the hospital. Then you've got to go from there. So it's pretty amazing. So let's see. The crisis, AFF Health News year-long investigation exposed staggering failure of U.S. healthcare. It systematically pushes patients into debt. So the diagnosis debt revealed the scope and severity of the crisis as no one has before. A quarter of those with debt owe more than $5,000, and nearly as many with any amount of debt don't expect to pay it off in their lifetimes. Black Americans are 50% as likely as whites to owe money for medical care, and 20% of U.S. hospitals will deny non-emergency care to patients with an outstanding bill. Okay? You don't pay, you don't get service. Pretty normal, but is that fair? I don't know. Probably not, but it's the way things are working right now. The investigation unmasked the opaque world of medical billing and collections in a vast new industry that preys on patients, and it garnered prompt attention and action in Washington and beyond. In intimate multimedia stories, Diagnosis Debt documented the suffering and sacrifices this burden forces on patients and their families. AFF Health News and our partners at NPR and CBS News, profiled people driven from their homes, new parents who took on extra work, and retirees pushed into bankruptcy because of debt. So here's the area where we look at the upended medical lives here. Click on that and see where that goes. So we've got all these people who have stories about how their medical bills have put them into massive financial stress, healthcare debt. It's a sad story, and it's primarily only in America that this is going on. There's a better way. There's got to be a better way. I know there is. And it's just a matter of doing some research and finding it. Credit was ruined by medical debt. She's been turned away from doctors, jobs, and loans. Her $50,000 medical debt. Yep. So, pretty incredible. So there's lots more stories here that we could talk about. Here's an interesting little thing. Will your hospital help your bill, or will it sue you? Yeah, they went in pretty deep and got some information. So we've got dots all over the United States, and the red ones, yes, they will deny medical care. So if you live up in, let's see, where's this one? Salt Lake City Primary Children's Hospital is red. Bogan Regional Hospital is red. Western County, Newcastle, Wyoming is red. A lot of reds are kind of sprinkled around. Most of them are up in the northeast area, around Chicago. Interesting. And then the unclear, it's 125 that are unclear, and then most of them say no, they don't deny care, which is great. So those would be mostly in Texas and Midwestern states, up north, and down in this area. So let's see I live in Temecula. Let's see what Temecula has. There's one. Temecula Valley Hospital. Let's click on that. So it's a Temecula Valley Hospital. Locations Temecula Valley. And they're Universal Health Services. They're a for-profit hospital. They've got 100 to 250 beds. And hospital collection policy. Unclear if credit reporting allowed. Unclear if selling debt is allowed. Unclear if denying care is allowed. Unclear if legal action is allowed. So they're decidedly unclear on all of these aspects. Financial assistance, billing and collections, all unclear. No policies available. Scorecard notes. No available policy. Hospital did not provide data requested by KA. So, so you can look this up by state, see who's who, see who's doing what. Interesting. It's good research. It's kind of fun to see all this. So it's on the political side, and I guess as it should be, but it's a real problem that we need to address as a population, and each community needs to figure it out for themselves so that they're taken care of themselves, taking care of their own people. So that's kind of my soapbox for the day. And see if I can bring myself back up here. There we go. And yeah, just thought that was interesting to talk about, that the Biden administration is actually trying to do something positive here by borrowing the medical debt from credit scores so that people who do have medical debt, and there's over 100 million of them here in the United States, that's 41% of adults, it said, have medical billing problems and are subject to this. So it's a big deal. If you're stuck in that and you want to talk about it, you have some questions, I may have some solutions, hit me up, direct message me, and we can chat. Okay, so have yourself an awesome rest of your day, and I'll be back tomorrow with another live show. So see you then.